I'm Maya, and I've been working with Fernanda, who is a community health promoter at Island Health. I'll be presenting on my practicum work with the Cowichan Valley Transportation Advisory Committee, also known as TAC. So I recognize that I am a settler to Treaty 6 territory, which is the traditional lands of Indigenous peoples such as the Blackfoot, Cree, and Métis. I also acknowledge that this project is based in the ancestral and unceded territories of First Nations groups like the Cowichan tribes, Malahat, and Liaxin. So my host organization is Island Health, and their work involves a system of public health professionals, community health partners, and healthcare providers. The population and public health team fits into this with efforts such as supporting community-based initiatives for local health priorities. This includes the transportation project that I've been working on with Fernanda. So for the scope of this project, the Cowichan Valley is identified by 3 local health areas in the central part of the island. These areas are used by Island Health to plan and manage the delivery of health services, observe the health of populations, and research community health outcomes. About 10.4% of the island's population is found in the Cowichan Valley. And while working with Island Health, I've been assisting TAC with researching transportation support for Cowichan. This emphasizes a deeper understanding of regional needs and identifying opportunities for resources. The committee is a collection of groups in the region that work in transportation, housing, economic development, and more. They focus on community-centered and multi-sectored approaches, and in doing so, they center transportation as a social determinant of health. So to do this, the committee intends to make a case-making toolkit that outlines transportation challenges, existing services, and potential strategies for the Cowichan Valley. My work is mainly to complete a report with 2 main items. So one is an asset map analysis of public, nonprofit, and privately owned transportation options. This includes collecting details such as eligibility, cost, and operating hours. The other is a literature scan for documents on transportation in the region, like ridership reports and broader studies on rural mobility. So to start this project, I looked at the populations in the region, and most prominently, there is a large proportion of older adults. More than a quarter of the population is ages 65 and older, and within this group, more than a quarter has low income status. Furthermore, older adults tend to have increased rates of illnesses, disabilities, or physical impairments that may require higher care. BC Transit states that the rural and remote communities that these populations live in create challenges for efficient transit. Specifically that 35% of the population is concentrated in North Cowichan and Duncan, whereas 65% is spread out among the outlying communities. So that's what that map there, not the electoral areas one, but the other one tries to convey. And for examining existing transportation, I wanted to start with the local transit, which operates in a regional district. This means that for each electoral area, the residents partly fund the public services they receive through fees and taxes. Therefore, each area independently plans and operates its own transit systems. So as an example, there's no scheduled transit services in electoral areas G, Saltaire and Gulf Islands, and H, North Oyster and Diamond. This is because there's no demand for public transit in these areas, and they're not part of that cost-sharing framework. This system can create gaps in service coverage, especially for interregional operations. The BC Transit survey in this slide shows that expanding hours and areas covered are the most common motivators for increasing ridership in Cowichan. Overall, low ridership is concerning since fees and fares are used for continuing operations and expanding services. So most of the existing transportation is facilitated by private automobiles. The BC Transit survey shows that in the Cowichan Valley from 2023 to 2025, 66% of respondents had not used their local transit in the last year. As for active transportation, this is limited by concerns like unsafe sidewalks in busy intersections and highways preventing easy access to locations like Central Duncan. These barriers are compounding, especially for those who rely on alternative forms of transportation. This commonly includes those with disabilities, low income status, and members of minority groups. So when it comes to the actual asset mapping, we're in a preliminary stage of our results. So looking at public and nonprofit organizations, this includes services like volunteer driving programs. As one example, Volunteer Cowichan's Courtesy Ride program for older adults requires registration, and it's specific to getting them to appointments. For what's privately owned, this covers services like ride sharing, such as Coastal Rides, which requires access to a phone or the internet to book a ride. For the Cowichan Valley, each ride will cost about 150 Canadian dollars at a minimum. This high price is consistent with most of the ride sharing services since they're usually based in Victoria or Nanaimo. During the asset mapping, I was able to practice assessment and analysis skills to identify that transportation options in Cowichan are limited, both in availability and coverage. So moving on to the other item, some background research on place-based health disparities was done to support TAC's agenda for health equity. This includes the rural health model, which conveys that the location of rural communities shapes travel and access to health. So as an example, if you live in electoral area D, which is Cowichan Bay, and you need to get to the nearest hospital, this would be in the neighboring municipality of Duncan. If you don't have access to a car, using local transit will take about an hour and 10 minutes with at least one transfer. And that would be to get to the Cowichan District Hospital. If you can use a car and there's no traffic, this would only take about 14 minutes. So in this scenario, travel time and availability of travel options can impact health, whether that's the stress of transit use or delay in care. Overall, this can contribute to poor health outcomes. So the work done in the literature scan involves identifying studies that align with TAC's agenda for inclusivity and equity. This can offer evidence for their case-making efforts. One study on inclusiveness and regional mobility involved rural residents with disabilities and examined their physical, social, and mental experiences with active transportation infrastructure. So the figures on the slide show this process where participants share photos of built environments and their sentiments on the design or state of these structures. This multifaceted study portrays approaches for gaining insights into community needs and the existing rural context. At the same time, there's limitations in this process, such as a lack of equity-focused transportation studies, and much of literature prioritizes the state of built environments or even urban centers. By contributing these findings to TAC's efforts, I've been able to practice my own capacity for public health advocacy and identify insights that strengthen the committee's case for improving transportation in Cowichan. So currently, TAC is working to formalize, so they're still kind of in their beginning stages, and I'm still contributing to research to their efforts. And so far, my main takeaway on public services is that broad scale availability of options does not necessarily equate to access for all. The current approaches to transportation issues typically leverage market-based solutions, which involve high costs or navigation of technology. This can alienate older adults or those with disabilities who often rely on alternative transportation methods. As for the Cowichan Valley, the relationship between regional mobility and access to health is a growing issue. In these articles, there are concerns about another transit strike and no funding for transit to the new hospital planned for the region. For these scenarios, TAC hopes to engage with the community and advocate for those in the Cowichan Valley who are most greatly impacted by the lack of adequate transportation. So thank you all for listening, and a special thank you to Fernanda, everyone I've worked with at Island Health, the Transportation Advisory Committee, and the staff at UVic who organize our practicums, especially Dr. Jeff Masuda and Heather Ulmer. And that is everything for me.